Do you frequently feel like your heart is pounding, even when you're just sitting? Or maybe you've noticed your pee looks strange, like tea or cola. What if your child had bad diarrhea, and soon after became very tired and pale? These signs might seem random, but together, they could point to something serious called Hemolytic Uremic Syndrome, or HUS. Think of your blood like a delivery truck system. Red blood cells carry oxygen to your body. In HUS, these trucks get destroyed, and your kidneys start failing, like a traffic jam in your body's cleanup crew. It's rare but dangerous. Let's explore what causes it and how we can stop it. So what causes HUS? Most often it starts with a nasty stomach bug, especially from a germ called E. coli O157H7. Imagine eating a burger that wasn't cooked fully. That juicy middle could be full of invisible bacteria. These bugs release a poison called Shiga toxin, which sneaks into your blood. This toxin attacks your small blood vessels, especially in the kidneys. It's like the toxin draws target signs on tiny blood highways, and when red blood cells pass by, they get shredded. This mainly happens in kids after bad diarrhea, but adults can get a form of HUS too, sometimes from genetics medicines or other infections. So bad food isn't just a bellyache, it can start a chain reaction. How do you know if it's HUS and not just a stomach bug? Let's play detective. First, the diarrhea. Not just any diarrhea, it's often bloody and lasts 5 to 7 days. Then, about a week later, the child or adult gets pale, very tired, and maybe breathless. Their pee becomes dark, like iced tea, and they pee less. That's your kidneys waving a red flag. Other clues: fever, bruising easily, or even seizures in bad cases. Example, a 4-year-old eats a raw hamburger at a picnic, gets bad belly pain and bloody poop. A week later, the mom says he won't eat and his eyes look yellow. That's jaundice from destroyed blood cells. These clues together scream HUS. It moves fast, so watch the timeline. No single test, but clues from blood and pee. They'll check, are red blood cells broken? Yes, if the blood smear shows schistocytes, shredded cells. Is kidney function down? Blood tests show high creatinine. Are platelets low? That's why bruises show up. They'll also test for E. coli in stool and rule out other diseases. Treatment: no magic pill. It's about support. Often, the patient ends up in the hospital. IV fluids help the kidneys. If very bad, they might need dialysis, the body's temporary kidney helper machine. Blood transfusions replace the destroyed red blood cells. Antibiotics, nope, some actually make the toxin worse. So care means rest, fluids, and close monitoring. The body often heals itself if supported well. Can we stop HUS before it starts? Yes, by stopping the starter, E. coli. Think like a food safety detective. Cook burgers to at least 160 degrees Fahrenheit. Use a thermometer. Washing hands after touching raw meat, must do. Drink only pasteurized milk and juices, no raw stuff. Wash fruits and veggies well, especially if eaten raw. During outbreaks, avoid recalls. Teach kids to wash hands after playing or using the toilet. Daycares are high-risk zones. Clean surfaces well. Also, if a child has bloody diarrhea, don't jump to antibiotics. See a doctor first. Some meds could trigger HUS. Prevention is about habits, small actions that block big harm. Science is moving. Recent research shows some HUS cases, especially in adults, are linked to mistakes in the body's immune system breaks. New drugs, like eculizumab, act like a switch to stop this overactive attack on blood cells. Used in atypical HUS, not the E. coli kind, it has saved lives. Trials now test if early use helps severe cases. Also, researchers are creating special tests to detect Shiga toxin faster, even from a simple urine dip. Some labs grow organoids, mini kidneys in dishes, to test treatments safely. Gene therapy might help hereditary forms, some. The goal: faster diagnosis, Smarter treatment, fewer dialysis days. Science is on the case.